I started in plastic surgery because one of my friends, who was a couple years ahead of me at UC San Francisco as a resident, kind of mentored me into what a wonderful, vast field plastic surgery was. And I just thought at first it was just cosmetic only, but when I saw the variety of cases that you can do in plastic surgery, whether it's reconstructive, whether it's aesthetic, it was just mind-blowing. And I just decided that it's a challenge that I just want to go after and learn as much as possible, and there's always so much more room for learning in this field.
And for me, it was really just a matter of finding my passion. Going through various levels of education, medical school, even into general surgery, just got exposure to all sorts of fields. And in the end, and I rotated on plastic surgery, it really combined everything that I wanted to do. I'm very blessed to be almost an even split in my practice between reconstructive and cosmetic surgery.
When the patients come to my clinic, some of them are apprehensive about having a lot of questions, whether they're taking up my time or not. To me, that's something I look forward to. And I think that that is the best part of my interaction with the patients. Somebody who's educated, who's done their homework, and will hear what I have to say about the procedure.
Consultations for me are really a dynamic process. Somebody's come in to see me for whether it be reconstruction or cosmetic surgery, and they're basically asking me to address their concerns and then get my expertise and opinion to see if that matches up with their goals and objectives. It's really an important job to take that information in, make sure that I understand it and I'm communicating to the patient that I understand that information, but also to embrace their goals and objectives and match them up with the reality of the anatomy and the surgical possibilities that are available to them.
I've been a surgical nurse for about 4.5 years. Dr. Wirth and Dr. Paydar perform the procedures. Most of the time when I work with them, they do tandem surgeries, which is amazing because you have two fantastic, very, very detail-oriented surgeons working together and kind of feeding off of each other. And you just see the work that's completed is just absolutely amazing. And so I knew right then and there that I felt completely comfortable with them doing my procedure and not only working with them, but actually becoming a patient. When patients are interested in having a procedure done, I always make sure that they're very well informed. Not only do they need to know a lot about the procedure itself and what it entails, but I always encourage patients to at least seek out 2 to 3 or 4 different surgeons to make sure that they feel comfortable. Because every surgeon is going to do things differently, has a different mindset, and a different bedside manner. So you really need to feel comfortable with that surgeon, that they understand your needs and wants, and that you click with them.
I like being around people when I can have fun at the same time that we're addressing their concerns. Surgery is still surgery. So if we can do that as a team and with some level of enjoyment at the same time, I think that's a win-win situation for everybody.
And I love interacting with patients. You really have to be a people's person in this field. Otherwise, there's no reason to be in plastic surgery. So I love interacting with my patients. I love making them feel better about themselves. And you know, the challenges they bring to me, I really like to actually go out there and make them feel better about whatever the problem is.
I see them in the OR, I see how detail-oriented they are, how clean they are. It just reassures me that the quality of care is phenomenal. They'll take as much time as they need to in the OR to make sure that what the patient wanted is what they're going to get. Dr. Paydar and Dr. Wirth are solely focused on what the patient wants, what their needs are. It's not about money, it's about satisfaction and the patient's quality of it and their experience.
The honor I feel that people put their trust in me on the reconstructive side to get them through a trauma or a cancer and make them whole again. But on a cosmetic side to say, here's an unnecessary operation, but it's really important to me and it has to be done right. And they trust me and they put their faith in me, that's a huge honor and a privilege. And I never take advantage of that. So when it comes back and it's spot on, and they just cry and laugh or hug, that's the reward. That's the joy of what I do. And I treasure every one of those moments.